Welcome. My name is Bruce Madsen. We're going to have a little wellness moment, and the number one thing that takes the life of an American is heart disease. Now, in terms of lost life years, cancer takes more life years. What does that mean? People die of cancer earlier than they die of heart disease, and therefore their life expectancy was, let's say, going to be 79.6 years. And if you died at 54, we took away that number of life years for an average expectancy. So, total number of deaths a year, heart disease is number one. So let's talk about just a few of the basics. When the research is looked at, we say that genetics loads the gun, but lifestyle pulls the trigger. Genetics we can't control, but lifestyle we can. In the research that I've seen, and I've gotten 8 different medical school newsletters, the best out there for heart health outcomes of any hospital in America every year since 1994 is the Cleveland Clinic. They get some of the sickest people in the world with heart disease, and yet they have the best outcomes in all measurables every year since 1994. So I get their monthly newsletter and their annual report on cardiovascular health. So I'll give you just a few. If your heart is not beating in a normal rhythm, but is fluttering, called atrial fibrillation, you have a 5-fold increase in ejecting clotted blood into your brain and having a stroke. I have paint, it's been sitting. It's not been stirred. That paint is what? Clotted or clumpy. Blood that is not correctly stirred by the heart gets thick and sticky and then is ejected into the brain. That's a form of vascular disease. And if we can't improve that and get you out of atrial fibrillation, you'll be placed on blood thinners so that you don't throw a clot. So this is also, a stroke is known as a brain attack, to give you an idea that it's very similar to a heart attack, only a clot in a different part of the body. Now, the brain can also have a bleeding stroke or a hemorrhagic stroke, but we won't go into that detail, just a point of clarity. So we want to assist that heart in stirring the blood, and we find people that 1 to 2 times a week do large muscle group rhythmic activity, have between a 30 and 40% reduction in risk for heart attack. Stirring the blood once to twice a week with regular large muscle group rhythmic activity, also known as aerobic exercise. So we want to stir the blood. Number 2, when you do aerobic exercise, your good cholesterol, or H for healthy, HDL, goes up, and your bad cholesterol, LDL for lethal, goes down. So, number 3, when you do large muscle group rhythmic activity, a chemical naturally is released called nitric oxide that causes your blood vessels to get larger or dilate, and they're more relaxed and elastic and better at blood flow. So let's remember, heart disease is the #1 killer in America. The research says that around 80% of heart disease is controlled by lifestyle factors, and the factor we wanted to look at today is regularly stirring your blood and asking blood to flow into the tissue, and the heart rate elevates, the blood vessels dilate, and we reduce the LDL or lethal cholesterol, and we elevate the HDL or healthy cholesterol. Thank you for this wellness moment.